evening. The news gang is here. Tonight, Maraga's rage. Who's on trial? A general response from the government's attorney. Also on the show, Waiguru's heavy lifting in Kirinyaga. Did someone talk about lighter duties? And mirror, mirror on the wall, what's the future of the deputy president? Some answers from the Talai telescope. On the memo tonight, Jamila asks, who is more equal than all of us under the law? Yvonne Stick dreams about the return of the dark days. The kicker is full of imaginations for the president. And Gachuri's punchline is in the footsteps of Wanjiku. While the angle stretches all the way from France, America, and back here in Kenya.
It is important to clearly and categorically state that this shortage of judges and the near paralysis of court operations has been caused by the President's refusal to swear in the 41 judges recommended by the Judicial Service Commission.
All right, welcome to the program. Very interesting situation there, ladies and gentlemen. But I want to park Maraga a little bit and just do a quick round because we've seen some developments with COVID-19 that are particularly worrying. I mean, the numbers have remained at triple digit. And yesterday, Jamila, there was a discussion, the intergovernmental team meeting, and there seems to have been a 30-day kind of deadline or roadmap that was put in place to see if indeed in July, in the middle of July, we can reopen the economy.
Yes, and all the county governors who met the president yesterday were told now they need to sit and look at ways that this can be possible by July. But as you said, the numbers are still there, still rising. There were issues with testing a few days back when we had, I think, 95 or 96 people who tested positive. But then we looked at those who had been tested, had been about less than 2,000. And of course, questions arose about testing, why we're not doing it as we should. And then no reagents, or we don't have enough of them. Of course, there's a huge demand for them the world over. But then now reopening is an issue. When the president spoke about, he said he really wanted us to reopen. I remember when he had his speech, the one where people were waiting for him to say he's reopening everything. But after advice from experts, he was told, no, you need to wait, because if we go the way we are, we'll have higher numbers. And he talked about the instances of what would happen if we reopened in December or November or October. It was all a grim picture. But I think it's very important now, if we want to reopen in July, because the economy has suffered. 1.7 million people have lost their jobs. That's what the Labour Minister was saying yesterday. And livelihoods have been affected. Businesses have had to close. And schools also have, children have been home for months now. Of course, now there's the plan to reopen in September. But I think it's now the governors to go and retreat and sit and look and see how they can manage this, so to be able to reopen. They've been given 5 billion shillings now to try help the fight against COVID-19, because we keep questioning, yes, Nairobi, there is some preparation going on in terms of ICU beds and equipment and personnel, but what about the counties? Siaya has been in the news, Busia has been in the news about being prepared to combat COVID-19, but governors, now it's up to them to sit back and say, is this possible for us to be able to do this in July? What can we do in each and every county to be able to do it? But as you said, the numbers are still rising. We still have people dying from COVID-19. We still have new infections every single day, and we're having challenges with testing.
Yes. Actually, we'll talk about some of those conditions or measures they have to put in place in a moment. But Lina, it's interesting that we're actually talking about reopening, and the numbers are also growing. Just underscoring what the president, I think the other day when he was speaking, called this battle between lives and livelihoods. That in fact, on the one hand, you have to make sure that people remain alive, not killed by COVID-19, but on the other, you have to secure livelihoods, because in the end, that could also kill people. And it's a veritable dilemma.
That's right. That's the dilemma that the pandemic has pushed and forced upon the entire human race, basically. All countries, all the economies are now having that debate on between life and livelihoods. And it is coming here. And what you're seeing now is impatience setting in on the impact that the restrictions is having on livelihoods, especially the economy. And you can sense that the government really wishes to get this ended, wishes to get this reopened, but they still have to listen to the experts on what they are saying. But we must also celebrate the good news. Way back in March, I think, and early April, the projection of a model by the Ministry of Health, Dr. Amoth had suggested that it is possible for the numbers to hit between 5 and 10,000 by the end of April. We have not reached there yet. We're just over 2,000 now. That is good news.
Yeah, we passed 3,000. I think yes.
3,000. Sorry,
yeah, but,
yes.
but
Yeah.
you know, still very far from 5,000. You're right. I think there's something interesting here, Gashuri, that we have seen. There's the balance that we are doing, but the question of county preparedness, it's come up many times. The president referred to my county the other day. It's been quite a conversation out there. But the conditions that they have to meet, we had about 300 beds, for example, per county minimum before we can talk about this. And we know that the beds never have we ever heard so much about beds in this country.
And it's not just beds, but because availing beds is not a big issue. You can avail as many beds as you can.
Kuna ule fundi
wa vitanda pale. But the kind of beds we are talking about are accompanied by various other things. We're talking about a proper isolation center for COVID-19 cases. I'm looking at the numbers. Today is the 91st day of coronavirus in Kenya. And today was the 85th briefing by the Ministry of Health, though via a statement because of the budget making process, of the budget process in Parliament. 121 cases today out of 3,291 samples. In total, we are talking about 3,215 cases, 106,247 samples tested so far. The state of preparedness in counties is still dire. In fact, I would say the reason why we didn't have reopening the other day is as a result of the state of preparedness in counties. If today Nairobi was to be reopened and generally the country was to be reopened, the influx of Nairobians up country would be huge. And that would in essence translate to the number of infections there. But my question is, if we were told only 10 beds are available in your county, Siaya, and 9 were occupied then, and a day or two later, the other bed that was available was also occupied, it means if you're to ferry people up country, the number of infections would escalate. And people may have thought about Siaya and Busia because they were cited as examples that particular day. But the state of preparedness in all the 47 counties is not yet up there. And so as days go by, as more tests are done, as we get more positive cases, it continues to paint a picture of unpreparedness in counties, lack of facilities. Today I see in the budget, the government is trying to avail some resources to help counties boost up the numbers in terms of personnel, beds and everything else. But we are far, far, far from proper preparedness in counties.
Yeah, Yvonne, there's something that Gashuri was referring to, which I think is important to kind of elaborate a little bit more, because this idea of isolation units, because I think a lot of these counties did not have to deal with cases of isolation because, I mean, most of the illnesses that they handle, I mean, if someone is coughing there, maybe someone has malaria, the other one has typhoid, whatever, they're all in this thing we call general ward.
Yeah.
But now we have this disease that requires people actually to be sort of sequestered in some corner where there's no one else.
I mean, a lot of these hospitals in the county region didn't have to deal with big health ailments to begin with. You know, universal health coverage was really something that was starting to build up, particularly in the counties, with health being devolved. They were still dealing with all of the challenges of devolution of health, of personnel, of equipment, even of drug supplies by KEMSA. So they had a host of issues before this. I mean, I think the only places we saw, you know, special wards were those in Western Kenya and the Nyanza region, and those were the ones that were dedicated to those who have suffered from border accidents. But generally, that's what it is. And, even when we talk about, like Francis said, isolation beds, it's not just the bed that comes with it. An ICU unit is something that is far more complicated with all the equipment, plus the personnel who are required. Because in ICU, you're closely monitored. So you require, special nurses that look after you as opposed to the amount of personnel that you would require in the general ward. Which is why probably we've seen some more funding in the proposed budget to universal health coverage to the tune of 50 billion shillings that's been proposed by the cabinet secretary now. And what you're seeing now with the budget and everything is we seem to be entering post-COVID survival. You can see a sense of thinking ahead. So now, yes, whilst we're still struggling with testing and getting the reagents, but there's a lot of forward thinking. If you take a look at, was it just this week that we have released home care guidelines? On the 29th of May, Dr. Amoth sent a memo to all private hospitals on the resumption of elective surgeries. He said they can now resume it judiciously, but of course making sure that they have in place all of these measures. The president, when he was addressing the nation, asked the Interreligious Council 7 days, during which they have met and had their proposals. We've seen the same thing with, in fact, now we have, I guess, the most definitive date we have had in the whole 91 days we've had corona, that now we have a school calendar. At least we have a tentative opening date, that's September. And even with the second stimulus package that you're seeing, a lot of it is to now take a look at the effects of what has happened to businesses, economies, lives and livelihoods over the last 90 days. I was even speaking to Mike Mashari of the hotel keepers. They're saying they are ready. Remember, many of the hotels were used as quarantine centers. They said they had training from the Kenya Health Federation. Their staff were trained. They knew exactly what to do. So for them, they're good and ready to go with just implementing the required protocols and social distancing and sanitizing. So you get the sense that, the reopening of the economy and the country in many ways is imminent. Like everybody has a 7-day deadline, a 30-day deadline, and we're now saying post-COVID stimulus, post-COVID reopening, post-COVID survival. So, yeah.
And I think, Joe, there's a realization that it's not possible to keep telling people stay at home.
Right, yeah.
It's not going to be tenable.
Yeah.
Because for 1 year or for several months, it's not going to be possible. Now, we are moving from stay at home to stay safe. Yeah. Everything that you do, stay safe. Where even the extension of the curfew was basically part of that stay safe. And maybe there's a likelihood, even in the next briefing, that even the curfew could be done away with, so that people can have 2 shifts, daytime and at night. Because on one hand, you have an economy to deal with, you have livelihoods to take care of, and there's a realization. It's now obvious that the government cannot be able to feed everybody. So eventually we will have to go back to normalcy, but in a phased out manner that does not put us back into trouble.
Yes, actually the CS, Treasurer CS Ukuri Atani yesterday said that the virus itself has impacted so much on the economy that it is now becoming difficult for the economy to support the response against the virus, basically underscoring the fact that the virus is here to stay. And something else